Hi, this is John Kanellopoulos from our office here in Athens, Greece. I want to share with you a very interesting case that we saw here today. This is a 41-year-old lady with very poor vision. Her visual acuity has dropped to count fingers in both eyes without correction, and best corrected 20/70 in the right eye that we're seeing here, and 2100. Actually, I take that back, 2400 in the left eye that we're seeing here. And the running diagnosis for this patient was neovascularization related to contact lenses. This patient is also a very high myope. Her glasses are -7, -3 almost, astigmatism in the right, and -975, -3.25 against the real astigmatism on the left eye as well. Intraocular pressures are 10, and we're going to see some more elaborative testing done with the anterior segment OCT. We'll see here images with the anterior segment OCT. We're seeing centrally here the right eye. We can see how sick the epithelium is and how thin the cornea is inferiorly. But it's the section here, remember we're starting from inferior and going to anterior, that shows us that the inferior half of the cornea has thinned tremendously. Almost half, even more half the normal thickness that we can see in the anterior cornea. Let's go and look more elaboratively. This is again the right eye and how thin the inferior part of the cornea is in the right eye. And we're gonna see the same images on the left eye, which appears to be even worse. See how thin the cornea is on the left eye, 326 microns. Just off the center inferiorly, and how the thinning has really come across almost half of the inferior cornea. So our thought process here is that this is probably not, and again, the Scheimplug tomography images showing the corneal irregularity on the left and how significantly the thinning is. It's even more exacerbated on Scheimplug images. It shows a thinnest point of 151 microns, which is a little bit exaggerated due to the opacity. And thinnest on Scheimplug imaging on the right, 277 at this very thin inferior area. So the pachymetry measurements almost look like pellucid macular degeneration, but we all agreed here that this is an inflammatory disorder of the left eye and the right eye that, in my opinion, is mainly caused by acne rosacea. We can see the significant blepharitis in this patient, very swollen eyelids, and the interaction of the staphylococcal antigen on the cornea surface creates this elaborative reaction that's very vivid and has such a significant toll and visual debilitation in this young lady. So we have a long way to go here. We're going to try and separate the cornea from the eyelids, maybe a bandaged contact lens. So we're going to go against what she was told, not to wear contact lenses, because this was from contact lenses, and of course treat the blepharitis with oral doxycycline 100 milligrams twice a day, and antibiotic corticosteroid ointment to use 2-3 times a day. The doxycycline will help, besides the blepharitis, as an anti-proteolytic agent for the cornea thinning, and hope that this will improve the cornea thinning picture. But of course, long-term rehabilitation may require a keratoplasty technique, a patch graft here, maybe a smaller penetrating graft in the cornea, but a better assessment of that we will have once this very hot picture of the inferior cornea does subside. This is the left eye, final images, and this is the right eye. And again, a very young lady with a very, very dim clinical picture that has escaped the care of many clinicians here in Athens, and that we hope that we can make a difference in her treatment. This is John Kanellopoulos signing out. Thanks so much for your attention.